Welcome to Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is. That's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we have a special guest joining us, and her name is Jennifer Fink. Jennifer is the founder of the Fading Memories podcast. Fading Memories is a podcast that helps families who have loved ones with dementia and Alzheimer's. Welcome, Jennifer.
Thanks for having me.
You're welcome. So, Jennifer, tell us a little bit about Fading Memories podcast.
Well, I will give you the history as quick as possible. I have been an avid podcast listener since podcasts had to be listened to through via the web. Thankfully, we have podcast players now, which just fueled my love of podcasts. They're fantastic for listening while you're doing other things, which is interesting because my mom loved talk radio. I am an avid reader, and I was reading books and doing deep internet research and trying to find ways to connect with my mom. And one day at the gym, it hit me like a 5-pound dumbbell upside the head. I was like, I should go home and look for a podcast that talks about Alzheimer's caregiving, because if you've looked for a podcast on something, you'll probably find it. Well, there was one. This was the end of 2017. And unfortunately for me, it was not my cup of tea. But being an avid podcast listener, that's easy for me to say, I had been listening to one called Side Hustle School, and he had done a bonus episode on how to start your own podcast, he was kind of focusing on companies like yours, as it was podcast kind of as a sales tool. But crazy me, I thought, oh, that sounds fun. I'll just start my own. And so the plan for the podcast was to be informative and inspirational, somewhat like a caregiver best friend that has been there, done that, and understands what you're thinking, feeling. The only thing is podcasts yet are not interactive, so you don't get that friend feedback, but it's as close as possible to being your caregiving best friend.
What are some stories that you have gotten from some of your listeners that have maybe shared with you how your podcast has helped them?
Just people feeling like, oh, they're just grateful that the information is so easily gotten, that it's kind of a breath of fresh air to listen to.
Sure.
Quick funny story: the very, very first episode I ever recorded, I listened to it, I'm like, yes, okay, that's the information I wanted to get out. I was very much on, you've got to understand these certain things, and my husband listened to it and he went, oh my gosh, that's really negative. And I'm like, what? So I listened to it again. And I'm like, yeah, I can see how somebody would think that's negative. And I thought about it. I'm like, I don't think I'd want to listen to this if it were me. So it went into the computer trash and is gone forever. So I can't even resurrect my very first horrible episode. So it was after that I decided, it needs to be as uplifting as possible, because as we all know, dealing with somebody with Alzheimer's or dementia is a challenge, both mentally and physically. And so I needed to produce a podcast that is fun and easy to listen to. So that's what I did. And that's kind of the feedback I get. I get people saying, oh my gosh, this is the information I needed to hear. This is great info. 99% of my guests are either current or former caregivers, family caregivers generally, and everybody's got their own story to tell. So sometimes the information might be a little bit repeated from, prior months before, but it's always attached to a different story. So I like listening to it. So I figure, and I learn things from it. So I feel like other people will enjoy listening, and they will also learn, just a little bit of advice that might help them along their journey.
Absolutely. One of the things that, we're quite fond of saying to families is a lot of times you may know somebody that has dementia, but you really just know that person because it's such a, wide scaling illness that not everybody is affected the same way, which I'm sure, you can appreciate that. And sometimes the stories may be the same, but it may be a different story for a different person because their loved one is being affected by it so differently. One of the things that I enjoyed about your podcast and your website is you have some great books listed on there. I love to read, and I'm always looking for new and more interesting books. That's something you and I talked about when we first met. And, why don't you talk about your book collection that you have on there?
Most of a lot of my guests are authors because they just decided that putting their information out in one place and letting it go out to the world was probably smarter than creating a podcast every week, like me. But I had planned on writing a book, but at the time when I started the podcast, I assumed that my mom had many, many, many more years left to live, and I should write the book after she was gone. So I have about 50 books, and they're all from caregivers that have been there, done that. And it ranges everything from children's books to I have a couple books called two lap books. They're beautifully illustrated, and each page has basically one sentiment or statement. Like, I really love sitting outside in the sun. And of course, it's a beautiful, older people with young kids sitting outside in a garden, and it's just beautiful. And my mom loved those books because, like us, she liked to read too, but she was pretty far along with the Alzheimer's, and she couldn't track for more than a minute or two. So the only stories that I could read to her were like super short funny stories that were like literally a couple pages on my iPad. So, and I also have, let's see, I keep looking at the bookshelf like they're going to jump out at me. I have, over the summer in 2020, I talked to a gentleman whose dad had Parkinson's dementia, and he wrote a novel that one of the characters has dementia, well, as has Alzheimer's. It's a little bit of a dystopian futuristic novel. It was really good. And I really appreciated that he took his personal experiences and turned it into a work of fiction, or at least I hope it's fiction, because there's some parts in it that if it comes true, it's not going to be good.
Okay.
So it's just, the collection is it's varied, I should say, and it touches on pretty much every episode that I've recorded has probably an article or a book or a blog connected to it. Like the dying experience, which is a recent episode, palliative care, that one's not a book. That's the one I'm working on. I just it's everybody's stories and how they manage the journey of Alzheimer's. So they're good. I have
Very
lots of them.
and very helpful. Very helpful.
Mhm.
One of the things that we find, and I'd love your input on this, is when a family's recently diagnosed with having a loved one with dementia and they go to their doctor and they do testing and maybe they recommend Aricept or one of these other medications, that's kind of where the support medically kind of ends. They don't tell them any sort of, tips or suggestions necessarily how to get them to take a bath or to brush their teeth. And, it's all the day-to-day stuff, all their ADLs. When you meet with a family or an individual and their loved one's first diagnosed with dementia, and they're just starting out on this journey, and, it can be a very long journey or it can be a quick one. And that's the unfortunate part. There's really no way to know for sure. What would be the one piece of advice that you would give to them to help them on their journey?
That one's easy. I tell people, as soon as you suspect, as soon as you have a diagnosis, sooner rather than later, put a care team in place. You will need help. My mom had Alzheimer's for at least 20 years. Okay. So this is 2021. I just want you to try to fathom the year 2041. Just project yourself into that year and ask yourself what you'll be doing. It's impossible. At least I can't do it. And I give a lot of suggestions that I learned from a previous guest and his mom on how to do that. Because a lot of people hear, get help and they think, oh, that's bringing a caregiver in my home. And I don't know that I want that. And, you hear the brakes getting hit right away. What I suggest to people is take some time, day or so, write down everything that needs to happen every single day. Obviously, you need to eat and, keep the
Right.
house clean and get groceries, and it's make that list. Then just put it aside, review it, see if there's anything that needs to get added to it. Then make a list of everybody you know and what their skill set is. And they don't even have to be in your hometown. There are people that can maybe make phone calls, they can call and check in, or they can do Zoom calls like we're doing now. There's a lot of things people can do to help you that don't require them to physically come into your home and do things. Like, I cannot deal with talking to insurance companies or banks or any of those institutions. Just the thought of it makes me tense. Well, my husband worked in banking for 20 years. So, whenever one of those phone calls needed to be made, and now he's a real estate broker. So, he still deals with this bureaucratic nonsense on the phone. He would make the phone calls even though I was the trustee and the healthcare power of attorney. And once he got into a person and he'd start telling them what we needed, and then they'd find out, oh, wait, I'm not supposed to talk to this guy. Then he'd put us on speakerphone, because sometimes it was the way they'd word things. It's just like
Sure.
sometimes people say things and you hear it differently than I say it. And so that's just how we handled it. It kept me from blowing up and not having a successful phone call. It kept the person on the other end of the phone from having somebody yell at them for something stupid. So that, people can do that with you. But there's a lot of things that you can hire people or ask people to help you do. My husband picks up groceries for an elderly woman here in town. And he drives for Meals on Wheels one day a week, but then he also goes and picks up groceries for her and brings them to her house. And I guess she gives him a check. I don't really know how that part works. Not really worried about it, but that's an option. You've got somebody that's already out doing things. Maybe, somebody can help, navigate the, the Safeway, the grocery store app, so that groceries can just get delivered to you. There's a lot of things, somebody to take care of the yard, housekeepers to take care of your house. The more tasks you take off your plate, the more you can take care of your loved one.
Right.
And that's going to happen more and more and more, to the point where you're taking care of them full time, and cooking and cleaning and dealing with all the other stuff is just a giant added stress, and you don't need that. So find a team that can help you with everything, so that when you get to the point where you need help, you're not asking for help in a panic,
Right.
because then it's too late. And don't think you can do it all your own, because you can't. And you shouldn't want to.
No. And that's good advice. Now, you had mentioned that your mother had recently passed, and that was right at the start of COVID, I believe you shared with us.
Yes.
How do you see this situation with COVID and the pandemic and all these restrictions affecting families who have loved ones either in facilities or, in their own home? How do you see that affecting them?
The forced isolation has been horrific. I know many people living with some form of dementia, frontal temporal dementia, or Lewy body, and they seem to have accelerated in the decline, which, I mean, we know it's going to happen, but let's not do anything to accelerate it, right?
Right.
Now we're talking about the vaccines. My mom was in a memory care residence. She was fighting with the caregivers, because that's happens a lot. People get combative. She didn't think she needed help. And when she did need help, she got very angry that she was getting help. It was very, very frustrating. And she fell and broke her leg, literally right at the start of the pandemic. Because I
Mm.
remember her in the hospital, and I was like, do I want to be in the hospital? Do I want her in the hospital? She went back to the care facility on March 12th. I saw her the 12th, the 14th, the 16th. And on the 17th, they said, "Psh, that's it. No more visitors. Everybody stay away. We don't know what we're doing." And at first I was okay. I'm like, okay, this governor was talking about a couple weeks. So I thought, okay, a couple weeks we can handle. And then it became obvious it wasn't going to be a couple weeks. And I got very concerned, because she knew me as her best friend. And my concern was because she was at an advanced stage of Alzheimer's and obviously combative and not trusting, that if she didn't see me for a couple weeks, she would forget I was her best friend and we would have even more problems. So I have worked from home for like 16 years. I was not going to the grocery store. That was hubby's duty. I was not going anywhere. There wasn't any place to go. So I was like, okay, it's been 10 days. Okay, I'm about to okay. I had a good relationship with the executive director and I was about to call him and say, "You tell me how do you want me to do it, but I'm coming in. You want me to climb through the window? What do you want? Because I'm coming in." That was going to be the conversation we had. But they called me and said, "Sure, she's not doing so well. Maybe she should have a visit from you," which I have now translated into, "Oh dear, we better let them in because this isn't looking good." That was March 29th when they called. I saw her on the 30th and she passed away on the 31st. So I didn't see her the last 2 weeks of her life. And there are times I wonder, how often would I have been there? She did have hospice. She had the caregivers. She was asleep a lot. So I don't know how much I would have or wouldn't have been there. I would have been there more than zero for sure.
Right.
But the whole shutdown, the whole no family can come in, no visitors, we can't have like caregivers weren't going into people's homes. That was okay for a short period of time, but it's been a disaster for people living with the disease and the people caring for them, regardless if they're paid caregivers in a residence or family at home. The adult day programs have been closed. Just, it's like a lot of the support networks got yanked out from underneath people. And I have had many conversations with caregivers that said, my mom's in a memory facility. We need to come up with rules. Like I don't think my mom could have handled a window visit. I'm not Her visual processing was so bad that I'm not sure she would have had any clue what was going on. So that wouldn't have worked for us. The only way a video call would have worked was if it was a really big screen, I think. I'm not even sure if that would have worked. And I really don't know because she hadn't used the telephone for years. I don't even know if that would have worked. So, I'm really grateful that she decided to pull the plug right at the beginning of all this nightmare because, here we are at the end of January 2021. It's been a year since the pandemic hit our shores. We're still at home doing Zoom calls. So it's like I have no idea what I would have done with my poor mother. It would have not been pretty. So we need to have conversations on like how we can regulate people coming and going to keep people safe, but also not keep them so isolated that their brains just deteriorate faster.
Yeah, my family and I this weekend, on our way home from church, we were driving and we had to pull in a parking lot, and it happened to be a nursing home facility that we pulled into, and there was a man standing outside the window doing his window visit, with what I'm assuming is probably his mother, and my kids are fairly young, and they're like, why doesn't he just go in and say hi? And so they know about the virus, they know about the seriousness, but they don't understand why things are the way they are. And they just said, well, mom, if you were in there, or dad, I I wouldn't want to stand outside and see you. I would be sad. And what if I get sick? You're not going to be able to see me. And but that translates a lot to our loved ones who are dealing with dementia. A lot of them revert back to that, childlike mind, and they don't understand it and they can't be expected to. And a lot of times, you know, they need that, that comfort of their family and those familiar faces and familiar voices. It's been very challenging. We know several families here that you know their loved one had passed and they didn't even get to go in on their last day, or get to talk with them. And it's just so tragic what's been happening with a lot of these loved ones in these facilities who are suffering from dementia and other illnesses as well. Hopefully
Yeah.
there will be some conversations soon to start getting things at least more semi-normal. I don't know what that looks like, but I know that's got to be better than what's been going on.
Well, I did see there was a caregiver on Instagram who was in the state of Oregon, and I sorry that I could never go back and find this particular post, but she was saying it was basically a cry out to the governor of the state of Oregon. And she said, she'd thought about it and she felt like family members should be able to make half-hour appointments and follow, obviously masks and maybe gloves and all that, although my mom would not have dealt with that well. And, maybe if you just go into their room and, my maternal grandfather always said, you don't get out of this life alive. So I would rather have put my mom at a slightly higher risk to see her and continue her life as normal as possible than just, oh, well, I can't go see her. That's life. And just whatever happens, happens. That would not have sat well with me at all. And so I agreed with this gal, if they know who's coming in, they screen you, they, like everything else. If we can go into a grocery store or a Target, then we should be able to go in and see our loved ones. And the staff needed us too, because
Right.
now they have the only person they get to talk to is other employees and people whose brains are broken. And I was very much of the mindset that myself and the paid staff, we were all a team. So, part of like I probably was team captain because it was my mom. So I was removed from that picture. So I think that we need to really discuss, and it's going to be different for everybody, unfortunately, and it gets, then it starts getting political, and oof, that's just a whole other problem. But, I've seen comments online about, well, are you going to give your loved one the vaccine? And I am so glad I don't have to make this decision. I am completely pro vaccine. I am wondering if I'm going to get one this year or not. My husband, because he does drive for Meals and Wheels and realtors are essential workers, will probably get his way before me. So I'm not an anti-vaxxer, but I also was not doing anything to prolong my mother's life because she would have killed me if she did not get a flu vaccine in 2019 for that specific reason. So I would not give her the COVID vaccine, except that I would want to make sure that she was not putting other people at risk, which
Right.
that's just a lot of brain gymnastics trying to figure that one out. So I'm really grateful I don't have to figure that out. But there's a lot of people that they're rushing out to get their loved ones vaccinated. I have a past guest whose father was vaccinated this past Monday, and he was really out of it. And she
Mm.
doesn't know if it was the vaccine or just because he's declined a lot in the last year. Nobody will know for sure. A lot of people have said their loved ones have had not necessarily adverse effects, but just been really kind of withdrawn and quiet and just different. And I'm assuming they probably don't feel really great because that's typical, but it's like we don't know how that's going to affect them and their brains. I don't think it'll do anything with their poor, overtaxed brains, but it's just a lot of unknowns, and I'm very, very
A lot
glad I
of
don't have
unknowns.
to deal with
Right. That's in a,
my husband and I are Rotarian, so anybody that knows a Rotarian knows that we've been working for since the late 80s, I think, on polio eradication.
okay.
So I'm completely pro-vaccine, but
Right.
this whole last year has been, it's been an interesting scientific learning curve, and we have to pretty much we have to be like seriously positive thinking, like, okay, yeah, I'm going to let you give me this vaccine that didn't exist a year ago. Okay.
Yeah.
So
Well, and just talking about loved ones getting the vaccine in these facilities and things, I had just talked to a family yesterday. Their mother is in assisted living, and she has the beginning stages of dementia. And the facility a couple weeks ago, they had told all the family that they were coming in to give all of the residents their vaccine. Well, the family's not quite sure yet what fell through, but they ended up not coming in to give everyone their vaccine. So yesterday, the facility notified the families that all of the residents were going by bus to a clinic to get their vaccine, which I found a little interesting. But then their mother refused to go. So
Lord, yeah,
every
my mom would have been that way too.
and everyone else had went, and her mother said, I will not go unless my daughter can go with me. That's the only way I'm going. Well, we still have visitation restrictions here, and there was no way the daughter would be permitted to go. And so, it presents a lot of different challenges because now she's not vaccinated and the family's not sure if she's missed her opportunity, at least through the facility, because that was all arranged for yesterday. So now they're really concerned and they don't know what to do, because they got special clearance because, again, aging facilities, nursing homes and things like that, they got precedent in your frontline workers. So now the family's trying to figure out, okay, she's not going to go anywhere unless the daughter takes her. The daughter's not allowed to go into the facility, so I mean, it creates a lot of unknowns, and the family is obviously very concerned. And so it's just, it's difficult. It is so challenging. And I think even more so when you are dealing with somebody that is struggling with dementia. It's not like just you have an elderly, otherwise healthy loved one who's maybe in an independent living or, is in assisted living and just needs a little help here and there. When you add dementia into the mix, it changes the dynamic so drastically, in a lot of these facilities, unless it's a specialized memory care facility, they're not especially trained for dealing and handling people that are, dealing with dementia, which again adds another layer to it. It's really hard. It's so hard for these families, and, our heart goes out to them, and to you too, Jennifer, because, I know, we've shared a couple of stories and things, and, I cannot commend you enough for your podcast. I've listened to several episodes. I've been to your website a few times. Always looking for good book recommendations. So keep those coming.
Yeah, that's on my to-do list.
On that little to-do list, right?
I didn't think podcasting would take so much time, but this part of it doesn't, but all the rest of it, all the back office stuff, geez
All the back off,
Louise.
right? So for people listening or watching us who would want to get in touch with your show and learn more about it, where can they go to find Fading Memories?
You can go to the website, which is fadingmemoriespodcast.com. My apologies for the giant URL, but Fading Memories is obviously, it's a book and a band and a movie.
Oh,
And
wow.
quick funny story, I went to buy the domain name and it was right before lunch and I'd been at the gym, back in those days when you could do those things. And I pulled it up and I looked at it and I went, I must be hungry. I'm gonna go get some lunch. And I came back and I looked at it again. I'm like, says $36,000. I'm not spending
Wow.
$36,000. So fadingmemories.com was $36,000. So, and I wasn't too sure about, .org or .help or whatever, all the other different, whatever they call those, but all the whatevers. I'm just like, this is going to confuse people. So fadingmemoriespodcast.com. There's links to Apple Podcast for each show and Spotify. And then there's a link to find us on the Android podcast player for the Google phones.
Okay.
Or you can find us on any podcast player. You can, I bet you if you Google Fading Memories podcast, you can find me because I am all over social media and the internet and, no privacy. So
How old is your podcast now?
it will be 3 years old on May 1st, 2021. I've been
Wow.
working on it for 3 years, but I released the first episode, not that first one I told you about though. The first good episode, which is a conversation with a gal with younger onset Alzheimer's and all of the things that she is doing. And so that was 2018. And I think I talked to her in March or April. And she's seen me like 3 times since then at the state advocacy days. And then once via Zoom recently. It was also attached to the Alzheimer's advocacy that both of us do. And she still remembers me. And I'm super impressed
That
because
is great.
I'd be like, she looks familiar. And I'm like horrible with names. So, it's like, I wouldn't be able to remember her name if she's wearing a name tag. That has been my curse my entire life, but she still remembers me. So it was a much better first episode than the one that didn't get aired, that got trashed, because she talks about a lot of the things that she does to keep herself as mentally healthy as possible with Alzheimer's.
Okay.
So that was a fun conversation. We did it in the library in the conference room.
Wow. Okay. That's a good
Yeah.
spot. Yeah.
It was fun. It was nice to actually do podcast interviews in person. It's a little better with Zoom because I have more control over the audio, and I don't have to rely on people that are just close to me physically. Thank
Right.
goodness, since 2020 kind of fix that anyway. But yeah, I have a gerontologist that's going to be a monthly guest host, and then probably starting in May, I'm not sure when we're starting with his shows, but I have a neuropsychologist who's going to be talking about brain health, and he will also be a guest host once a month.
Oh, that's great.
A lot of good stuff coming.
That is a lot of good stuff. Well, we're going to share all of your information in our show notes as well. And hopefully people can check out the show and your website. Like I said, the website has great resources and information on there. And I'm not one that's a cooker or a baker, but I also know you have some good recipes on there. And it's just, you're doing a great thing with a lot of good information.
Thank you. I try. Yeah, I have now that we're back to hardcore workouts again, even though they're at home, I'm going to test out and probably publish 2 protein muffins, which would be really good for everybody. But, when you've got a loved one that's starting to forget how to eat, and as we know that sugar is the last taste to leave it's definitely going to be my last taste sensation before I go. That, it's sweet, it's easy to eat, but it also provides some nutrients and protein and healthy stuff
Right.
for people whose family members are struggling with eating, which also happened with my mom at the end. So stay tuned for that.
All right. Well, we appreciate your time today, Jennifer.
Thanks so much.
All right. You have a good day, and make sure to go visit fadingmemoriespodcast.com.
Thank you.
All right, Jennifer. Bye-bye. We want to thank you and Jennifer for joining us here at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate long-term care issues. Please visit us at allhomecarematters.com, where there is a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. If you know someone who could benefit from this episode, please share it with them. And remember, you can listen to the show on any of your favorite podcast streaming platforms and watch the show on our YouTube channel, and make sure to hit that subscribe button so you never miss an episode.
Thank you for joining us today. We look forward to you joining us again on another episode of Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.